It's Dr. Kevin Most, and he joins us now live from his comfort of not having to get up and go to work every day. Good morning to you, Dr. Most.
Good morning, Steve. How are you guys doing?
We're doing great. Jane's here.
So great to hear
Nick's
your
here.
voice, Dr. Most.
Great,
Hi, guys.
Great to have you back. All right, so after working your tail off every day for all those years, 1 month into it, how are you adjusting?
I'll tell you, it is an adjustment, Steve. You know, the alarm not going off at 5 o'clock in the morning, I was just telling Tom, not checking emails at 10 o'clock at night, not looking first thing in the morning to see if the hospital is full and what we need to do. I think I'm relaxing a little bit, which I saw a bunch of docs on Saturday night, and they're like, oh, man, you look so relaxed. That's either good or bad.
That's good.
Well, we appreciate the continued access and the knowledge you bring because medicine is your life and you always stay in touch with it, and you will. And the time you give us is important. So we encourage people to send those questions in when they have them. You could certainly even text in now or call if you got a medical question. Can't fix you over the phone or by text, but can give you some advice. But we got to ask you about a couple of news stories first. Toby Keith passes at 62 after an 18-month fight with stomach cancer. And again, you don't have access to the records, but what is it? Well, talk about stomach cancer for a second.
Yeah.
What do we need to watch?
Yeah, it's really sad. And the bad thing about stomach cancer is that there really is no one specific cause. Now, any individual who has had ulcers in the past and has had H. pylori, you might have heard of that before. Those are individuals that are going to be at higher risk for it. Individuals who smoke is probably the biggest one. And some diets that will certainly lead that, salty foods, pickled foods, things along those lines. People who drink alcohol on a regular basis, those are all going to be individuals that could have a higher chance. The bad thing about it is the signs initially are very subtle. In other words, I have a little indigestion. So what do? You take some Pepcid or you take some antacids, and that feels a little bit better because those early signs are showing irritation in the stomach, and those medicines are settling that down. So feeling full after eating a small amount of food, losing weight, loss of appetite, those are all ones that are going to be there. But again, they're very common symptoms that people don't think, I must have stomach cancer. So it's unfortunate because often by the time it's found, it is so advanced that there's not a lot that can be done about it. So that's the unfortunate part.
But a while ago, you told me, and I've seen this unfortunately in my own life, I lost a cousin to this. If you see blood in your stool, sorry if you're eating breakfast, you need to get it checked out, right?
Yeah. So there's two things about that, Steve, and I'm glad you brought it up, is people, if you see bright red blood in your stool, you need to get it checked out. That's going to be a sign more of colon cancer, that you have bleeding that is still fresh at the farthest point, I'll say, from your mouth. Mm-hmm. Individuals who have stomach cancer, where that bleeding is occurring in the stomach, that often will turn black. So if you have a black stool, that is very concerning as well. That means you're bleeding much higher. So those are individuals who actually even have ulcers or have a bleeding ulcer, which again can be the start of cancer. That bleeding ulcer, when it bleeds, the body breaks that down and it comes out in your stool as black. So those are the two different ones. Bright red blood, be concerned about colon cancer. Black stool, be concerned about any higher bleeding, not just cancer, but bleeding in your stomach.
And what's interesting? My brother died of stomach cancer in 2007, and he had a distended stomach, and he just thought he was fat. He thought, I'm just gaining weight like Dad did, and it ended up being a tumor, and so they had to have surgery to take that out, and then he had to fight his cancer battle as well. So that's another thing. He didn't pay attention to it because he thought he was just getting fat, but in fact, it was a tumor.
Yeah, Jane, and you hit it on a really good point, is that a lot of subtle symptoms that we just say, this must be due to something else. Anytime you have a symptom that doesn't make a lot of sense, like your brother might say, gosh, why am I getting fat? I'm not eating anymore. Right. I'm still exercising as much. Any of those little small symptoms, get in to see the doctor. At least have them take a look at you and say, hey, you know what, I've noticed this. Because often by the time you get to that point, there is concern. But absolutely, swelling in your stomach is another one of the signs that you will see with stomach cancer.
Yeah, I think it's appropriate to talk about this, too. We got to bring up, King Charles, which we can do on the other side of the traffic in a break. But Just talk for a second about going to the doctors, because men are bad patients. I would argue at times women are worse because women are too busy taking care of us. When people don't want to go to the doctor and then finally go, you can put yourself in harm's way that you didn't have to deal with in the beginning. And, the reasons you've heard them your entire career, the reasons they don't want to go, well, I don't know, it's a stupid thing. I'm sure it's nothing.
Fine.
It's probably fine, all that. What do you want to say to people about that?
No, that's why we go to school for anywhere from 7 to 15 years after college, is to understand all those little nuances that people have. But people have to understand, people that say, I don't want to go because I thought you'd find something bad. Well, that's exactly why you go.
Right.
Is if we do find something bad, that we can take care of it. And the earlier we can find it, the better. But you're never wasting our time. People say, I didn't want to go because it was just nothing. I didn't want to waste your time. You're not wasting our time. Doctors will take that opportunity to say, hey, you know what? No, everything is okay. Glad you came in, and this is what you need to look for. Or we're going to check your blood pressure then. We're going to talk to you about other issues. We're going to do more than just deal with one little thing that you might think is nothing. So please do not put off going to the doctor. I can tell you there's so many stories of people where had we caught something earlier, had we even seen them earlier, the outcomes would have been so much different.
And I was told, or I heard this a couple weeks ago, that if it has anything to do with your heart or your head, go to the ER. Because you're like, I don't need to go to the ER. My head hurts or blah, 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 whatever your excuse may be. But I was told, heart, head, go to the ER.
Jane, you make a really good point that, if you're having chest pain, it's not like, I'm having some chest pain. Maybe I'll try to get in to see the doctor and get an appointment in a week or two. So you're absolutely right. Irregular heart rate, chest pain, chest discomfort after exercising or shoveling snow or something along those lines. Yeah, that's not one, let's wait and see the doctor. And again, head, it really depends. If you're a person who normally gets headaches and you continue to get the same headaches, certainly going in to see the doctor is appropriate. If you're someone who never has a headache and you get a very terrible headache, that's go straight to the emergency room. And any other individuals that have any signs of strokes, those are not like, hey, you know what? Grandma's arm's a little bit weaker. Her speech is a little bit slurred. Let's put her to bed and see how she's doing in the morning. No, those are the ones. Get in right away, because those need to be treated immediately. And the advances that we have made in not only stroke care, but cardiovascular care in this country are just absolutely phenomenal.
Dr. Most, more in a moment. Stand by, sir. First, Dr. Kevin Most is here. And Jane, we got another gigantic name in the news.
Big, huge news story. Yesterday announced that King Charles has cancer. We don't know what kind of cancer, but they caught it early enough, and saying it's not connected to the prostate, or what he was in the hospital for the prostate. Do you know any more, Dr. Most? I know you're not treating him, but what can we gather from this?
Yeah, Jane, it's interesting. If he weren't the king, and you said, hey, this individual had this test or had this procedure done and they found cancer, what would you think? So I'll go that route and then I'll come back to the other. So when you have the TURP that he had, in other words, what they do is they kind of take out some of the prostate tissue, which allows you to urinate a little bit more easily. It's one of a very common treatment that men get, as 80% of men, probably closer to 90% of men, get an enlarged prostate as they age. And if it impacts their ability to urinate, then they're going to go in, they're going to take a little bit of that tissue out to do that. Well, as they do that, they look into the bladder with the scope, the camera. Mm-hmm. So when I hear, boy, he had TURP done and that was fine, all the tissue that was taken was benign, but they found cancer, you would start to lean at least thinking, boy, it's probably a possibility that it's bladder cancer. Could it be other cancers that they would find along that track? It could be, but bladder cancer, I would say, would probably be the biggest one just because they look. Now, that being said, now I'm going to go back to he's the king. So, when you go in for even something as simple as that, I am sure they are running a multitude of tests and a multitude of scans on him, which could have identified any other cancer that may not have been picked up in the past. Could be a leukemia, could be a lymphoma. Just from blood tests that routinely are done. But if I was going to just put the two, the procedure with the cancer and the way that they set it, I would lean probably more towards a bladder cancer.
As we continue, there are some basics to get through here on stuff that everybody's dealing with this time of year. Cold and flu and RSV seasons. Remember, you had an RSV question, Jen?
Well, RSV season, they say there was a decline, but it's not over yet, especially for the United States.
Yeah, Jane, it's really interesting. If you look at the numbers over the past, I would say 3 weeks, RSV is down, COVID is down, influenza is down. Now, last week they took a slight bump up, which is not uncommon for influenza and not uncommon for COVID. But it's been a very interesting year because when you track the infections. Now, there's a couple of reasons. One is that both the vaccines, the COVID vaccine as well as the flu vaccine, are kind of pretty good at blocking these illnesses. In the past, we've had flu vaccines that are, 20, 25% effective. This year, it's way higher just because they but they got the right strain in the vaccine. The COVID vaccine is working well, even against the new JN1 strain of COVID, which has just taken off over the past month. The JN strain that we're seeing right now, the first case was noted in September. November, it was 3% of the cases. December, 20% of the cases. Now it's over 90% of the cases. So that strain is really seeming to be infectious, but is also being protected with the vaccine. So we're going to see a little bit more flu season. It is not done yet. So, if you haven't gotten your flu shot, I'm going to say, well, you still can, but it's pretty late. But certainly I think that people should look to see how effective the flu shot was this year and remember that next year in the fall when they're saying, should I get a flu shot this year? So.
And the shingles, again, is 2. If you're a typical member of this audience, you're certainly of age where you should get that done. It's 2 shots over the course of, 6 months max?
Yeah. So, and absolutely. I'll tell you, anybody who has had shingles in the past would be the biggest cheerleader for this. You certainly do not want to get it. You certainly don't want to get it as you age because your immune system is even weaker to fight it off. Because you have to remember, a lot of the people listening today had chicken pox. And that once you've had chicken pox, that virus is sitting in your body somewhere, just kind of hanging out, and it's looking for an opportunity to come out and wreak havoc. And that's what it does with shingles. So certainly, and it's a great shot. The shingles shot is outstanding as far as protection, well over the upper 98% effective. So certainly I would be one that I would not miss.
And you might feel crappy for a day or two, but you won't get shingles. So it seems like a fair trade.
It's a very good trade.
I gotta get that.
All right, brand new feature I just invented. Jane's Wacky Maladies. All right, what's the one we didn't hear of before today?
A lot of things I haven't heard of ever, except for the last 3 weeks. Costochondritis.
Well, it's interesting, Jane. We were just talking about, and you brought it up, saying, hey, if you have heart pain, go to the emergency room. So costochondritis is interesting. If you think about your body, you have ribs, and as you take a deep breath, your ribs move up and down, right? So you think, oh, yeah, okay. Well, if you think about it, your sternum or your breastbone doesn't move at all. So there's a joint, not like an elbow joint or a knee joint or a wrist joint, but there is a joint where the rib attaches to the sternum. Now, the bad thing is that can sometimes get inflamed. And when it does, it is uncomfortable. It hurts when you take a deep breath. It hurts when you cough. It hurts when you push on it. But people see that as chest pain. And it is, right? Technically, it's your chest and it hurts. But it's an inflammation of the joint where the rib attaches to the sternum is costochondritis. Very difficult to treat because, let's say you sprained your wrist. We'll put you in a wrist immobilizer and we'll say, hey, you know what? We want you to rest that. We can't tell you, hey, you know what? Stop breathing for 3 weeks and we'll see how you're doing at that time. So we know that people are going to continue to have this. We tell them to stop exercising any way that could stretch that out and to just kind of monitor it and take anti-inflammatories. Not serious, but certainly very uncomfortable.
Yeah, and a little scary too. And you answered it right there. Quit exercising. And I was wondering, how is this triggered? Where does this come from?
Yeah, and it's actually interesting when you talk about exercising. It's often triggered by using too much weight and too quickly. So people say, you know what, I'm going to go exercise, and all of a sudden I'm going to start lifting this amount of weight. or it is I haven't played golf in 6 months. I'm going to go hit balls really heavily. It's any motion that will impact that joint that hasn't been built up to a point of being normal. So acute, quick pain. You reach for something very quickly. You're thinking you might fall. You reach out quickly. So it's anything that's going to cause inflammation in the joint, just as it would in your knee or your wrist or your elbow. So it's, people who have common, normal movements are not going to get costochondritis. You have an unusual movement or you do something unusual, you certainly can inflame that joint.
And lastly, in the final minute that we have here, is it called compartment syndrome? Is that the term?
Yeah.
This is where you lock yourself in small spaces?
No. Yeah, this one is a little bit more serious, unfortunately. So, we all have muscles, and then those muscles, we have wrapped around those muscles is essentially something called fascia, which is like a fiberglass, and it kind of holds our muscles in one place. And that fascia then attaches to tendons at the end, which allows a muscle to work. Tendons attach to bones, the muscle contracts, and in that fascia, it works fine. If you get trauma to that fascia to a point where you have bleeding inside, so get hit really hard, car accidents will do this a lot, some football injuries will do this, their bleeding happens in the muscle there. Well, the fascia is stronger than that. So what happens is that bleeding continues, the fascia continues to get more tension, and you get discomfort. So people that get this, if you've had an injury that was kind of substantial, but you see pain that is greater than you would think, that's our biggest tip-off as doctors. It's like, wait, what did you do? Well, you shouldn't be in this much discomfort. But essentially what happens is the pressure inside that muscle gets so big that it stops the blood supply, and it ends up where you can end up with necrotic or dead tissue. Treatment for it is we go in and we cut open that fascia and we allow that pressure to come out. So it can be very serious, severe pain when stretching, numbness, tingling, all of those, and pain that continues to get worse after an injury.
If you have this, should you fly?
Well, this says, this is not an issue where you have a blood clot in the blood vessel.
So flying wouldn't necessarily make it worse?
It wouldn't make it worse. Certainly, this is something you're going to want to get taken care of. It's not like, I'm going to go on vacation, I'm just going to rest this and see. No, if you're continuing to have worse pain, get checked before you go on the plane, because those same symptoms that we're talking about can be a blood clot as well. So you certainly want to know any swelling in that lower leg. It's very common to happen there. So certainly getting that checked to make sure that it's not a blood clot and finding out that it may be compartment syndrome.
It is Dr. Most, and we're very happy to have you here.
Yes.
I know how much the people you work with miss you, but we love that you're with us. And check it out on Tuesdays at 7:30. Unless something important like a nap comes up for Dr. Most, he'll be here.
Or breakfast.